I'm here to change my life today and take the right steps forward.
Today is the day that we did our 1,000th bariatric procedure here at Mountainside Hospital.
Well, I chose Mountainside Hospital because it's a center of excellence for bariatrics.
If I was considering bariatric surgery, the things that I would look for at a hospital were, first of all, if they're a center of excellence by the American Society of Bariatrics, if the surgeons at that hospital are center of excellence physicians, if their complication rates are well below the national average, and they provide a team approach in order to make it easy for you to get to surgery and to succeed afterwards.
I think that patients should be looking for center of excellence as it relates to bariatric surgery because it's an assurance to them about the program itself and what they had to achieve to receive that designation.
Well, today I'm going to be Dr. Strom's 1,000th patient, and it gives me the confidence to know that he knows what he's doing.
Just an unbelievable feeling today to get to that point, to reach 1,000 patients in such a short time.
This program is about quality of life for patients. Some of these folks have not been able to go on a vacation, sit in an airplane seat, play with their grandchildren, walk without a walker. But for others, it's also about their medical issues, their diabetes, their hypertension, their sleep apnea, their joint pain. So it's a multifaceted disease, morbid obesity. And studies indicate that bariatric surgery, as of today, is still the most successful treatment for all of these comorbidities.
Bariatric surgery has evolved significantly over the years. It used to be a big open procedure with a big midline scar. It was over a 7-day hospital stay, usually involved the ICU. A lot of complications from this, where today it's done with little incisions, minimally invasive, laparoscopic. The band procedure is a 1-day hospital stay. The bypass is a 2-day hospital stay. The gastric band is a restrictive procedure. Basically, it's a collar placed around the upper portion of the stomach to form a new stomach above it. The new stomach above it is half the size of your fist, so as you eat less food and you feel full. It acts like a funnel. The funnel opening is small. As the food gets digested, it trickles through slowly. You lose about 1 pound to 3 pounds a week. 50% of your excess body fat's lost in the first year. The gastric bypass is a little different. The gastric bypass is a restrictive and malabsorptive procedure. Restrictive means, once again, we make the stomach half the size of the fist, but the difference is here we reroute the intestinal tract downstream 125 centimeters, so as food first travels down, no calories are absorbed. The combination of the malabsorption and the restriction, you lose about 60 to 70% of your excess body fat in the first year.
Today I'm going to have the lap band done at noon. They're going to go in and place a band on the upper part of my stomach, giving me almost another stomach smaller on top. It's equivalent to 1 ounce pouch. So it's going to be limiting portion control. So it's going to start my weight loss goal.
Bariatric surgery actually is a life-changing event for most patients. You'll see older people that might have been in walkers now are chasing their grandchildren around. You'll see younger people advance in their jobs and their education. So all different aspects of their life are affected by this.
The procedure itself is 45 minutes. Then I go to a recovery room afterwards, and then I'll be brought up to a room. I stay overnight tonight. It's laparoscopic, so there'll be 5 incisions. It's like puncture wounds. So there's no big bandages or anything. Hopefully by this evening I'll be able to stand up and walk around.
When it became a laparoscopic surgery, which is minimally invasive, the surgery is much shorter, the success rate is much higher, and the complications are virtually minimal.
Once a patient comes to us at a seminar to learn about our program, we will walk them through all the necessary pre-operative clinical work and insurance work to get them from seminar to surgery in a successful way.
They really back you up 100% because they give you support groups and everything to go for. I mean, they are there for you 24/7. They answer emails. I call 3 times a day. No joke. In January, I was on the phone with this office. They get back to you. They make you feel comfortable, and they know what they're doing.
The patients feel that we are really holding their hand through the entire process, and we're keeping in touch with them all along the way to bring them to surgery.
Well, they just don't leave you right after surgery, which is number one reason I'm doing it with Dr. Strom. He has a whole program. They have support groups here that meet once a month. You have a lap band, which they just started their own lap band support group, and they have a gastric bypass support group.
We make sure we provide them with the tools that are necessary to maintain that weight loss.
You meet with a dietitian who works with you on menu. Even just the pre-op meeting with the dietitian, we sat there with a book and went over measurements and food and what I should buy and a grocery list. I mean, they go really in depth. If I'm compliant with the doctor, the dietitian, and the exercise program, that I will be able to lose the weight to start with, keep the weight off, and go on to a healthy lifestyle.
I see these patients the rest of their life. I take care of them. I take care of their family members. It's a rewarding thing to be able to help others and see them change their whole life.
Having achieved 1,000 cases here at Mountainside Hospital in a short 4.5 years is really a monumental achievement. But we're now seeing patients coming from across the state, down at the shore, other areas, because they've heard about our program, they've heard about our quality, and they want to be here and come to Mountainside Hospital.